Hi, hello, my name is Jose, second semester student. I'm going to go ahead and do a head-to-toe assessment on a post-op day 1 appendectomy patient.
Nice.
So,
Well, I
knock knock.
have a bachelor's in international business. Okay.
Coming into the room, I'm going to do my 60-second situational assessment.
Well, I graduated right then.
I'm checking the beds in the lowest position. I'm looking at my emergency equipment. Hello, I'm just going to squeeze in here and check all this equipment, okay? Checking my O2, my vacuum, my angle bag, my yonker. Okay. Hello, my name is Jose. I'm going to be your nurse today.
Hi.
All right. I'm going to go ahead and check your ID band, okay? Can you please tell me your first and last name? Your date of birth?
12/27/75.
Where you at right now?
Grossmont Hospital.
And what brings you in today?
Appendectomy.
Appendectomy. Okay. All right, Miss Brandy. So I'm going to go ahead and do head-to-toe assessment, but before I do so, I'm going to go ahead and take a set of vital signs on you, okay?
Okay.
Patient is talking to me, so I can see she's not in any distress. She's being appropriate and she's good to go. Okay, I'm going to go ahead and take a set of vital signs on you.
Well, I guess maybe you probably wouldn't know this because I'm in the hospital, but I think, I don't know, where do you put like hours in? Is there
Or your
like a,
arm over here.
like how I would submit for today,
Okay.
or like meetings or things like that? I don't have to do any of that.
Check your temperature.
Christine Gersh, okay.
98.1, good. Blood pressure cuff on you real quick. Is it okay if I use your right arm?
Mm-hmm.
All right.
So CC, Christine, so she can do it, but also CC Gabby, because Gabby's the one
Okay.
who asked you. And when Christine sees that you're not just by yourself saying, hey, throw an extra day on this.
Right.
You know, you've got.
Yeah, I've done a few like extra cover things at the last couple months that were not, exactly, weren't programmed, plugged in from the beginning.
Okay, you can go ahead and relax. Okay, so we take her blood pressure. Her blood pressure is a little on the high side, which is kind of expected due to the fact that she just had surgery. So I'm now going to assess her for pain. Do you have any pain at the moment?
A little bit.
A little bit? From 1 to 10? What do you think the pain is?
A 2.
A 2? Oh, so you're not really in pain. Okay. All right, and what is your tolerable pain level?
Like a 5.
Okay. Like a 5. Okay, so whenever your pain starts to get like around the 4, please let us know so we can go ahead and medicate you so we can control your pain level, all right? All right, so would you mind I go ahead and take a look at your incision? Okay, but before I do, let me go ahead and put on some gloves, okay? Oh, I'll take this off as well. I'm gonna go ahead and raise the bed to my waist level.
How about all their students in the morning? 8 o'clock?
We had a group come in, yeah.
Oh.
Okay. I'm gonna go ahead and lower the blanket here.
Yeah.
Now, only expose what needs to be exposed. I'm gonna go ahead and lift up your gown, okay?
Mm-hmm.
Never really know.
Yeah.
So I am visually inspecting the right lower quadrant, which is the incision site of the appendectomy. I'm making note of the drainage. The dressing looks dry, looks clean. I'm looking at the surrounding skin. It looks intact. The abdomen appears to be a little bit distended, which is expected due to the fact she just had abdominal surgery. Okay. Okay, so that looks good, and your pain level's a 2, so we're doing very good on your pain management. All right, so I'm gonna go ahead and now just resume my head to toe, okay? All right, so I'm gonna go ahead and do curl on you. So I'm gonna go ahead and check your pupils. So I'm gonna ask you to just go ahead and look straight. Okay. Pupils are about at 5 millimeters, and they are brisk and reactive to light. Okay. Next, I'm gonna ask you to pull down your mask for me, please. And I'm gonna ask you to do a couple of silly things for me, okay? So go ahead and smile. Puff your teeth. Frown. Raise your eyebrows. Okay, good. I was checking for facial symmetry. Okay, let's go ahead and cover put on your mask again. Okay, next I'm gonna go ahead and take a look at your head, okay? I'm gonna lower this. Okay. So I'm checking for any bumps, any sores. Do you have any pain in your head at all?
Mm-mm.
Do you have any pain at all in your body besides your incision site?
Mm-mm.
Okay. Have you noticed any changes in vision? Any a headache? No? Any changes in memory?
No.
No? Okay. All right, and I'm gonna go ahead and check your skin trigger as well, okay? This looks good. All right. So next, I'm gonna go ahead and listen to your heart and lung sounds, okay?
Mm-hmm.
So I'll start with your heart sounds. So we're going to listen to your aortic, pulmonic, Erb's point, tricuspid, and then would you mind lifting your breast up, please? And then we're going to do your mitral valve over here, midclavicular line, and we're going to listen there for a full minute for the apical pulse. Okay, good. Next thing, I'm going to listen to your lung sounds. So right upper lobe, left lower lobe, middle lobe, right middle lobe. Would you mind raising your breast one more time? And then your right lower lobe compared to your, and then your other breast, please. And then your left lower lobe. Are you having any difficulty breathing?
No.
Have you had any palpitations or any chest pain?
No.
No. Okay, good. All right. Next, I'm going to go ahead and listen to your abdominal sounds. So I'm going to start at your. As I'm doing this, I want to be very careful to not put too much pressure on the incision site because I do not want to aggravate the pain of my patient. So we're going to start at the left lower quadrant. I mean, right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. So her bowel sounds seem to be hypoactive, which is expected due to the fact that she recently had surgery. But yeah. Okay. Have you how has your appetite been? I know you haven't eaten in a while. We have your unclear liquids, but how have you been tolerating those liquids?
Pretty good.
Pretty good. Okay.
Yeah.
Well, just keep it up, and hopefully we'll get some new orders to maybe start you on a soft diet and potentially regular diet. Okay. And no nausea or vomiting, right?
No.
No. Okay. When was your last bowel movement?
A couple days ago.
A couple days ago, being 2 days.
Yeah.
Okay. And how about your voiding patterns? How have you been peeing?
Through the bag?
Through the back. Okay, so you have a Foley catheter?
No.
Okay, so I'm going to assess the Foley. I'm looking at the drainage. I'm looking at the color of the urine. The urine appears to be yellow and clear. Oop. Yellow and clear. Okay. All right, and okay, so we'll be checking your okay, so we are going to go ahead and continue our head to toe here. All right, let me put this back up. All right. I'm gonna go ahead. Are you able to stretch your arms like this, please? Thank you. So I'm going to palpate, okay? So your skin is nice and warm and dry, nice and pink, appropriate for ethnicity. I'm gonna check your pulses. A little closer. Okay. And then I'm gonna check for capillary refill. Would you mind twisting your arms like this? Bang. 2+. Okay. Have you noticed any numbness or tingling in your arms? No. Okay. I'm gonna do the same thing, but now on your legs. Okay. So let me uncover you here. And by the way, just a reminder, I did close the curtain. May I ask you to please stretch your leg here? Good. Okay. So your legs are pure, nice, dry, clean, appropriate for ethnicity. Any numbness or tingling in your legs? No. Okay. You can check your pedal pulses. Okay. 2+. Gas pedals. And then towards your face. Good. All right. Anything missing there? No, that should be good. Okay. I'm just trying to think if I'm missing anything. But if I did, I'll make sure to come back and check on you. Let's see. Okay. Next, I'm gonna lay you flat. Is that okay with you? Or okay. You let me know if you feel any pain at any moment. Okay. So I'm gonna lower your head. And then I'm gonna make sure I raise this rail over here, just for your own safety. Since your incision side was on the right side, I'm gonna have you turn towards your left side, because that way you'll feel less pain. So I'm gonna now ask you to go ahead and roll towards your left side, okay? All right, are you comfortable?
Mm-hmm.
All right. I'm gonna go ahead and listen to your lung sounds on your back, all right? And also, as I'm doing this, I'm inspecting the skin, especially the bony prominences, making sure there's no bed sores, any redness going on. Okay, so I'm going to start listening to your lungs. So I'm going to listen to your right lower lobe compared to your left lower lobe, left middle lobe compared to your right middle lobe, and then right upper lobe compared to the left upper lobe. Okay, your lungs sound clear. All right, so I have assessed here. Okay, you're good. All right, go ahead and lay flat on your back again. Okay, Ms. Brandy, and could you tell me how is your support system at home?
That's good.
It's pretty good?
Yeah.
It's pretty good. So, who is your main support person at home?
My husband.
Your husband, okay. I'm gonna raise your head, okay? You let me know when to stop.
That's good.
Right there, okay. All right, I'm gonna lower your bed all the way down. I'm gonna give you your call light.
Mm-hmm.
Do you have any questions for me? Okay. All right. Well, if you need anything, please go ahead and call.
Mm-hmm.
And we'll be checking on you periodically throughout the shift, okay?
Okay.
All right. That concludes my head to toe assessment.